There are many healthcare innovations that require implementation at a unit level, whether that be a health service team, a practice, a ward, or an entire hospital or health service. These interventions, whether they be policies, equipment, new technologies, new ways of doing things, need to be evaluated. We need to find out whether they work or not. It's important then that we have tools for evaluation of interventions such as this. Standard approaches such as individually randomized controlled trials do not meet the needs of what is required when there are interventions that operate at a unit level. Cluster randomized controlled trials have been used for many years to address this problem of evaluation, but are limited, often in terms of the statistical power they generate and the ability to recruit enough units to be able to undertake a feasible investigation. A new approach that is rapidly emerging on the health services research landscape is the stepped wedge cluster randomized controlled trial. This experimental design is used to evaluate policies, practices, and other programs and innovations. First published in 1987, this approach has become increasingly popular in recent years, with near exponential growth over the past couple of decades. Now, this approach is actually a family of different research designs, with variation in recruitment, follow-up patterns, and intervention sequencing all possible. Now, despite the intuitive appeal of a stepped wedge cluster randomized trial, there are many drawbacks that can potentially impact on the successful use of this design. This presentation is going to outline the basics of the stepped wedge cluster randomized controlled trial, but also equip you with some of the important information you may need to know if thinking about using this trial design yourself, or if you are simply reading a research paper that has used this approach and you need to question whether this evidence is trustworthy or not. I look forward to seeing you at the presentation.